Hi, my name is Amy Booth and welcome to Our Climate, Our Health, where we discuss all things related to climate change and healthcare. I trained as a medical doctor and spent several years working in hospitals, treating a range of conditions. I managed COVID wards on the front line during the pandemic. But during my time working, I became more and more aware of how unsustainable healthcare is from an environmental perspective. So I decided to leave clinical medicine and focus on how we can make our health systems more sustainable for both patients and the planet. What I have found during my time working in this space is that there's not a lot of awareness around this topic. So I'm here to teach you more about climate change and healthcare, both the impact that climate change has on our health, but also the harm that healthcare does to our environment. Climate change is the biggest threat to humanity's future, and all governments, sectors, organizations, and individuals need to play their part in reducing this impact. Climate change is going to have a disproportionate effect on our health, from air pollution and respiratory disease to food insecurity and malnutrition, to an increase in vector-borne diseases where they previously didn't exist. The WHO estimates, very conservatively, that climate change could cause an additional 250,000 deaths per year, with other estimates reaching as high as 5 million. In addition, about 100 million people are going to be pushed into severe poverty with all its related health effects. And unfortunately, this health impact is not going to be spread equally, with developing countries, largely in the global south, taking the brunt. So climate change is going to have a severe impact on our health, and we need to be aware of this. On the other hand, healthcare itself harms the environment and inadvertently contributes to all the health conditions that I mentioned previously. We probably don't think about the impact of healthcare on the environment because healthcare saves lives, right? But one of the things that COVID has helped to highlight has been how wasteful healthcare is. I'm sure you've all seen the piles of PPE that we just wore once and discarded, or the disposable masks floating in the rivers. We use so much single-use plastic in healthcare, and it's often unnecessary. And waste is just one way in which health can harm the environment. Healthcare is also massively resource intensive. It runs 365 days of the year, 24/7, uses energy and water, has a complex supply chain and a large carbon footprint. It's also the source of a lot of environmental pollution in the form of pharmaceuticals in the environment and chemical runoff. So, climate change is going to affect our health, and the provision of healthcare contributes to climate change. Certainly a vicious cycle unless we do something about it. And that's what we're going to unpack in future videos. We will chat about some of the health conditions that climate change will cause and go over how the different elements of healthcare harm our environment. And then we'll chat about solutions and what you and I can do about this. Whether you're a healthcare provider or a healthcare user, this is something that's going to affect us all. Let's work towards sustainable healthcare provision for all in a healthcare system that is resilient and ready for the burden of climate change. Remember, a healthy planet is a healthy population.